I had to like get away from the smoke real quick if because I felt like if I didn't, I would like stop breathing for a minute.
My chest gets tight and I feel like my lungs are squeezing together and I can't really breathe.
It feels like my heart is beating really fast.
No, it feels like you're under the water and you can breathe.
Many of us already know that smoking cigarettes is bad for your health. It causes cancer, heart, and breathing problems. But sometimes we don't think how cigarette and cigar smoke might also be hurting someone else, like your children.
Problems that children can develop if they're exposed to cigarette smoke or secondhand smoke includes problems like respiratory tract infections, including bronchitis and pneumonia. They can also experience ear infections as a result of secondhand smoke, and they can also have more asthma symptoms and more asthma attacks if they're exposed to secondhand smoke.
Secondhand smoke is the smoke that comes from the burning end of a cigarette or cigar. It's also the smoke breathed out by a smoker. When someone breathes in this secondhand smoke, it can be just as harmful as actually smoking.
I've seen children have very severe asthma attacks after having an exposure to secondhand smoke, attacks that were so bad that they required hospitalization in our intensive care unit.
Secondhand smoke can also cause lung cancer and heart attacks in adults who do not smoke. There are more than 4,800 different chemicals and gases in secondhand smoke. 250 of them are toxic and act as poisons in the body. These include arsenic, cyanide, and carbon monoxide in a deadly combination. It is not something that anyone, especially children, should be breathing.
We estimate that 43% of children between the ages of 2 and 11 years are exposed to secondhand smoke. We also know that 40%, that's nearly half, of children who end up in the emergency department because of asthma problems are exposed to secondhand smoke.
Secondhand smoke in the home is especially harmful to children. Those who live in homes where people smoke get sick more often with coughs, breathing problems such as asthma, and ear infections. They're more likely to miss days of school. And children whose parents smoke are twice as likely to become smokers themselves.
They told me that secondhand smoke will trigger his asthma if we smoke around him or anything, but we smoke outside.
Very young children commonly have lots of viral infections, but if those same children, let's say children less than 2 years of age, are living in a home with a smoker, they're also going to be susceptible to having more wheezing, more shortness of breath, more difficulty handling those viral infections. And parents don't realize it, but sometimes when kids have these symptoms separate from a viral infection, these could be the early warning signs of asthma. And if there's a smoker in the home, it's very likely that secondhand smoke is the trigger for their young child's symptoms.
According to the Environmental Protection Agency, an estimated 1 million children with asthma have their condition made worse by breathing secondhand smoke.
We've had a few pretty scary instances where I'm driving to the emergency room and she's turning blue on me just because she can't breathe.
My asthma started acting up, and when we arrived at the emergency room, I couldn't breathe at all.
Estaba yo sola con el niño y pues ya tenía 15 días el niño enfermo, ¿verdad? Como a los 4 años. Estaba ya con... Él se dormía, pero yo tenía que estarlo viendo porque era el momento en que el asma le prendió más fuerte. Decía, papi, ¿qué tienes? Nada, pero él respiraba. Y las costillas de aquí se le subían y se le bajaban, se le subían y se le bajaban. Y yo lloraba.
We know that secondhand smoke causes premature death both in children and non-smoking adults. It causes heart disease and lung cancer, and children can be born with or can develop asthma, respiratory tract, and ear infections.
People have a lot of misconceptions about secondhand smoke. A lot of people think that it's okay to be exposed to a little bit, but a lot of exposure is bad. That's not really true. Even a small amount of exposure can be harmful. People also think that it's okay to smoke in the home or in the car as long as the window is open, but that's not true either. You're still going to expose that child to some smoke, And the smoke can linger in the home or in the car, even in the fabric and the furniture and the car seats for a long time. People also think it's okay to smoke as long as their child isn't home, or maybe when their child is asleep in bed. But that's also not a good idea because the smoke can linger in the household for a long time.
I have to tell my family and my friends, don't smoke around him because it will trigger his asthma.
When someone smokes inside a home or any enclosed space, everyone inside breathes the secondhand smoke. Babies are especially at risk, and mothers who smoke while pregnant are more likely to have their babies born with breathing problems or worse.
Smoking during pregnancy is a very dangerous thing. Research has shown that mothers who smoke during their pregnancy have babies who are at increased risk to die of sudden infant death syndrome, which is a very severe problem and can occur without warning.
Make your home and your car smoke-free. Be sure wherever you take your child is smoke-free. If you smoke, do it outside the home in an open area away from children. When out in public, make a point to go only to non-smoking places.
It's not so much about being confident about asking someone to not smoke. You're doing it for the benefit of your child's health. And anything that's going to benefit your child from not being sick or to not trigger them into an attack shouldn't raise any problems within yourself to ask somebody to stop, or within your friends and family, because if they care about you, they'll respect your wishes and your child and not do it around them.
If people are smoking, ask them to please not smoke in your home or car, and teach your children how to avoid secondhand smoke.
My recommendations for parents are to designate their home as being smoke-free, to remove lighters and ashtrays from their home, to put up stickers or reminders that their home is smoke-free, and that they shouldn't smoke in the car either.
If your child has trouble breathing or shortness of breath, talk to a doctor.
Doctors had lectured me and warned me about the effects of secondhand smoke on asthmatics, and for the sake of my daughter, I felt it was beneficial for me to quit smoking, for hers and my benefit.
For more information about secondhand smoke and quitting smoking, talk to your doctor, nurse, or healthcare provider, or call 1-800-QUIT-NOW, or visit these websites. Keeping a smoke-free home can help improve your health, the health of your children, and your community.
I've said, Dad, can you please stop smoking?
If I could do one thing, it was to tell my dad and my brother that don't smoke no more.
I would wish for my mom to stop smoking so her and me can get better.